All right. Thank you for joining us today. This is UNC Health's media briefing for Wednesday, May 13th. Today's briefing will focus on pediatric patients and the effect of COVID-19 on children, and including a rare pediatric illness that's thought to be tied to COVID-19. So after the briefing, immediately afterwards, an unedited video recording will be posted to YouTube for download immediately following the briefing, so you can get to that. It is completely unedited, and then we'll also have an unedited audio file that we can email folks if they're interested on using that for radio or just for note purposes. So at this point, I'll hand it over to my colleague, UNC Health's Alan Wolf, and Alan will introduce today's speakers. Alan?
Thanks, Phil. Thanks for joining us, everyone. Our expert guests today include Dr. Stephanie Duggins Davis. She is chair of the Department of Pediatrics at the UNC School of Medicine and physician-in-chief at UNC Children's. Dr. Davis is a pediatric pulmonologist whose research is focused on diseases that affect the lungs of infants and children. She is a world-renowned expert in pediatric pulmonology. Our other guest is Dr. Eveline Wu, Associate Professor of Pediatric Allergy, Immunology, and Rheumatology. Dr. Wu consults with UNC's pediatric team and coordinates testing and care for our patients when an altered immune system is suspected. She's an expert in primary immunodeficiencies and immune dysregulation, which can be linked with rare and genetic lung disease. Thank you both for joining us. Dr. Davis, would you like to make a few opening remarks to kick us off?
Sure, I'm just glad to see everyone here on the Zoom meeting, and I'm looking forward to just sharing with everyone what we know about COVID-19 in children.
Sorry, Dr. Wu, would you like to make a few opening remarks?
No, I just, yeah, I'd like to echo Dr. Davis's sentiment that we are excited to be here this morning to share what we know about how COVID-19 affects children and what UNC Children's is doing in part of the efforts with COVID-19.
Dr. Davis, could I ask you one question, then we'll kick it off to media questions. Has UNC seen many children with coronavirus at this point?
Right. So just kind of a brief summary about what we know about COVID-19 in children and what UNC has seen. We know that COVID-19 in children, the children in general present very mild, with very mild symptoms. And in fact, many children are asymptomatic. And the symptoms that children will typically present with when they present include cough, fever. They can have gastrointestinal symptoms such as diarrhea and vomiting, but this tends to be much more mild. At UNC, we have admitted 3 children who have tested positive for COVID-19, and only of those 3, only 1 presented with specific respiratory symptoms, and the other 2 were really admitted for other reasons and tested positive for COVID-19. So this is an evolving, we really are having an evolving understanding of how it impacts children, but in general, it does impact them much more mild than what we see in older adults.
So we'll go ahead and start taking questions from the media now. We have a number of folks on, so please just kind of step right up and ask your questions. And if you have any issues with being muted, let us know.
Hello, this is, can you hear me okay?
Yep, we can hear you.
This is Aaron Thomas with WREL News. We were seeing, I think we've seen some network stories on this particular syndrome. Is it possible that children, are there physical symptoms? Like, does their skin kind of inflame at all?
Yeah,
Dr.
so
Lee,
that's
could you take that one? Oh, sorry.
Yeah. No, that's okay. That's a great question. This post-inflammatory syndrome, what is it? I'm going to let Dr. Wu speak more about that because that has been something that we first heard about from the United Kingdom, and there have been several cases that have been reported out of New York. We have not seen that at UNC at this point, but it is definitely something that we're getting, really beginning to understand further. And so, Dr. Wu, do you want to say more about that?
Yeah, and so as you guys are all aware, there have been increasing reports of children who presented with what has now been called this pediatric multisystem inflammatory syndrome, which essentially means inflammation that can affect multiple organ systems. And there are features of the syndrome that are consistent with actually previously known, well-described conditions in children like Kawasaki disease and toxic shock syndrome. So Kawasaki disease is a condition that predominantly affects children and is characterized by inflammation in blood vessels, and that includes the coronary arteries of the heart. And in fact, Kawasaki disease is actually the most common cause of what we call acquired heart disease in children, meaning that they are not born with this condition. And children with Kawasaki disease can present with persistent fever, red eyes, changes to the lips and tongue, swelling in the lymph nodes or glands of the neck, swelling in the hands and feet, and inflammation in the skin or rashes, like you had mentioned. And then for toxic shock syndrome, it's actually a condition that's caused by certain bacteria and their toxins that can cause actually pretty dramatic drops in blood pressure where affected individuals need blood pressure support. Because of that drop in blood pressure and because of the bacterial toxins, other organs can also get very sick. And what we have learned from some of these previously described cases that have come out of the UK or New York is that children can present with a combination of features that can be seen with either Kawasaki disease or toxic shock syndrome. It seems that many of them do have fever. Some can have gastrointestinal symptoms like Dr. Davis mentioned earlier with abdominal pain, vomiting, and diarrhea. Some can have heart involvement, and some can be really sick with those kind of drops in blood pressure that we talked about and require some blood pressure support. Some of these, it's important to note that some of these cases are testing positive for COVID-19. However, some of them do not test positive for COVID-19, but we certainly have a high suspicion that this, pediatric multisystem inflammatory syndrome is related to COVID-19 for a couple of reasons. One, as Dr. Davis mentioned, we're seeing a cluster of cases in areas like New York that have had a high burden of COVID-19. And two, the timing of these cases are during or coincident with this COVID-19 pandemic.
Additional questions from the media, please just go right ahead.
Hey, it's Rose from North Carolina Health News.
Hi, Rose.
So I have a question. One of the kind of enduring questions that's out there is, are children, I guess the question is like, can they give older people the disease, right? So are they largely asymptomatic and able to transmit COVID to other folks? Or what kind of evidence are you seeing about their ability to be carriers?
Yeah, that's a great question. And as you stated, many of these children are presenting asymptomatic. In fact, one of the cases that was admitted to UNC was a child who was completely asymptomatic who tested positive before they went in for surgery. Because we are basically screening all our children and adults for COVID before they go to surgery or for any procedures right now at UNC. So that makes it difficult for everyone to know how to deal with this, I think, in the community. And they can also pass this to other people and adults. And typically, we've been using the kind of 6-foot rule and the physical distancing to help us with this. And so the answer is yes, they absolutely can pass this on to grandparents, other children, parents, adults, they definitely are infectious despite being asymptomatic. So we are definitely aware that that can occur. And I think that's part of the challenge with deciding things such as, do we open up the schools in the fall, and how do we move forward from that perspective? I do want to say one other thing. Though children can present asymptomatic and in general present with mild symptoms when they are impacted with COVID-19, there are cases, and there was a recent publication of at least 45 children who are admitted to pediatric intensive care units across the country. So children can, it's rare, but they can get very sick with this as well. And this is different than the multisystem disease that Dr. Wu just discussed. This is more from COVID. And the children that get very sick typically have comorbidities, such as they may have a reason to have chronic lung disease or other types of comorbidities that may set them up for being more at risk for getting more sick when they acquire a COVID-19. And there have been, again, very rare, but reported cases of deaths in children with COVID-19.
Additional media questions.
Hi, this is Anna Rivera with ABC 11. I know that it was kind of a sigh of relief for a lot of parents when they heard that, the cases are much more mild in children. Is there a reason now with this new illness emerging, is there a reason for parents to be more diligent or nervous, so to say, that now kids could be susceptible to something new and different that most adults haven't seen?
Dr. Wu, you want to take that?
Yeah, no, I mean, I think that's an excellent question. What we are constantly learning about COVID-19, and as pediatricians, what we have appreciated is that it can certainly present with a spectrum of severity in children. So commonly, we see children who have absolutely no symptoms at all, but we are learning to appreciate that some of these children can present very ill. It's still going to be more rare than children who have either no symptoms or mild symptoms. But I think it's important to have discussions like this with families as well as other medical providers to kind of increase awareness in the different ways that patients can present. And, so I think that, as providers, we can understand that there might be additional indications that we want to test patients for COVID-19, and for families understanding that maybe COVID-19 can present with other symptoms that might bring them, might encourage them to bring their children in earlier for evaluation for any of those symptoms that we just talked about. So I think it's more just having, a higher degree of suspicion for that. So things like fever, unusual rashes, the gastrointestinal symptoms like the abdominal pain and vomiting and diarrhea, whereas before might not have been a reason to be brought in for an evaluation, but certainly with COVID-19 might be the case now.
Dr. Wu, is it also true that this syndrome that you've been describing, sometimes there may be a lag, even a couple of weeks? Could you talk about that?
Yeah, and so like Dr. Davis kind of mentioned earlier, this syndrome is interesting in the sense that it's certainly in part due to the COVID-19 infection, because we think it's somehow that infection that triggers this response. But we actually think the syndrome has more to do with our bodies or our immune system's response to the virus. So anytime our immune system is trying to eliminate germs from the body, there's sort of this cascade of events that's actually really tightly controlled. And sometimes what can happen is during those cascade of events, if it is not tightly controlled, it can have sort of untoward effects on the body. And so we think that the syndrome more has to do with our immune system's reaction in fighting the virus as opposed to the virus itself.
Right.
And Anna, just to say a little bit more about what Dr. Wu said, one thing we have seen and this is important for parents, is that there has been a delay in bringing children in for evaluation because of anxiety associated with either going to the emergency room or going to their primary care clinic. We really want to encourage parents to take their children in. The hospitals and the clinics are set up in a very safe manner, and certainly we do not want children presenting more sick than they would have because of a delay. And we have seen that here at UNC, that children are presenting more sick in different, whether it's diabetes, you know, it could be a variety of things, to our emergency room because of this fear of coming to the medical center. And it's just, that could cause more harm than good. And we want to make sure that parents understand that.
So a follow-up question. So I know that kids are presenting milder symptoms and sometimes not showing any symptoms at all. Is it possible for a child, have you guys seen so far, I know not at UNC, but is it possible for a child to not have any COVID-19 symptoms and then all of a sudden this rash show up from this syndrome, this new syndrome that is appearing?
Yeah, that's an excellent question. I mean, it could be possible that some of what we're seeing is not necessarily COVID-19 related, or that all children who've been affected by this, what we think is a new condition, cannot be directly attributable to COVID-19. It seems though that a majority of cases are testing positive for COVID-19. The syndromes I had talked about before, so the Kawasaki disease and toxic shock, you know, Kawasaki disease is something that has been well described. We find that it's often triggered by a viral infection. Sometimes we can't identify what that virus is, and sometimes we can. So it is possible that some of these features we are seeing are not necessarily directly related to COVID-19.
But I will also say that it's going to take some of the registry data and the research that's currently occurring nationally to understand this. And this is why serology testing is really important to know if in fact the child has actually had a COVID-19. So that's serology testing, the antibody testing, where we can look for that.
Hi guys, this is Jimmy Price with CBS 17. I wanted to know, what should parents be doing inside the home to be protecting their children? Should they be wiping down toys more often? What are some of the things that they can do?
Yeah, that's a great question. And I would say yes, keeping things clean, wiping toys down for sure, and monitoring the children for symptoms if they develop symptoms, and calling their primary care physician if there are symptoms that are specific to COVID-19, such as fever, cough. Those are important, as well as avoidance. Having the child not be around other people that are sick. So I think that that's coming up. It's hard to do the stay at home. It's really hard when you're a child to do the stay at home. So I think that, you know, for parents trying to make decisions about what to do about camps this summer, all of that's going to be coming up over time as we go into these different phases and as we get past phase 1. So, but at home, basically good hand washing, wiping down surfaces, and keeping things clean are the most important things that the parents can do. And the one other thing that we have recommended, which honestly is hard to tell a 3-year-old, is you know, not to be touching your face and doing things like that. That's a little challenging when you're 3 years old. So you know, you just do the best you can without instilling anxiety into your child about everything.
And you guys mentioned too that a lot of the children are asymptomatic. So what can parents look for in those cases to know that their child may have COVID-19? So is it one of those things that until those symptoms persist that they won't know?
Yes. So I think there have likely been a number of children who have had COVID-19 that no one even knows they actually had it because they are asymptomatic. So they may, and you're most infectious actually right at the beginning of the infection when it actually occurs. So there's really no way for parents to know if you're completely asymptomatic if you've had COVID-19 at all. The only way that parents could suspect anything or be more heightened to look for symptoms would be if there had been some type of an exposure and that the parent was aware of that.
Great. Do we have additional media questions? Please just go ahead and ask your question.
Hey, this is Brighton McConnell with 97.9 The Hill in Chapelboro. Dr. Davis and Dr. Wu, thanks so much for taking the time to speak with us today. Obviously, the future of what schools in North Carolina are going to do in the fall is completely up in the air, but I wanted to ask, what level of concern do you guys have personally, or do your departments, or does UNC Health have with any consideration of schools becoming or moving back to in-person instruction in the fall?
Yeah. Great question. And I think there are several things that we need to think about. It will be important to monitor what happens as we have gone into phase 1 in regard to the increase or continued decrease in cases. That's the first thing. So I think it's going to be a week. We're going to have to take it week by week to make decisions about opening up schools. One thing I do want to highlight as a pediatrician, you know, I don't know if any of you have children who are doing online education right now. It is challenging. It's challenging for the parents. It's challenging for the children. And we also know from a mental health perspective, it's been challenging for children to not be around peers. So I think all of that has to be taken into account. So as we think about school in the fall and what will happen, certainly we'll have to monitor through the summer to get a better understanding of what happens with COVID-19. But we may have to, it is going to probably look a little bit different. So does that mean that we alternate and have half the children go one day to school to try to encourage physical distancing, and then have the other children go the next day, and you're doing remote the days you're not going in? I mean, I have a feeling we're going to have to think of some creative ideas with really smart educators to help us sort out the best way to do this. But we do know that from a mental health perspective and from an educational perspective, we need to come up with a good way moving into the fall, because this is a marathon. It's not a sprint. And so there will be a new normal, and there already is a new normal. And it will take some time to think about the best way to think about opening up those schools and what we need to do in the fall. We are certainly, from a clinic perspective, thinking a lot about that here at UNC and starting to ramp up our clinics. And we are seeing patients in person in our clinics, though we're still doing a lot of telehealth. But we're looking at what's the safest way to do it. How do we screen patients when they come in? How do we have physical distancing? And what are those patients that we need to see in person and those that we can do through telehealth? And so I think educators are going to also have to think about what the best thing is for the children from a school standpoint, and more creative solutions on how we can educate our children. Unfortunately, I don't have the concrete answer to yes or no in terms of school opening in the fall, but I can say that it will likely look different, and we need to really think about the mental health of our children and the importance of socialization. And Dr. Wu, I don't know if you want to say anything more.
Oh, and it just went out. We've only got about 4.5. Sorry, we only got about 4.5 more minutes too. So please go ahead though.
Yeah, no, I mean, I think just to add on to Dr. Davis's statements, as a UNC Children's employee, I have been impressed with, you know, clinical leadership and, you know, what they have done to ensure, you know, employees and children and their families are safe. And actually, you probably can see I'm in one of our clinic locations in Raleigh. And, you know, for families I've been able to see in person out here, I know that they have appreciated that, you know, we have created a space where they can safely bring their children that is removed from the hospital, so to potentially limit any exposure to COVID-19. As Dr. Davis mentioned, it's not only the families, but the providers. So I got screened this morning to make sure I wasn't having any symptoms that would suggest I'm sick. We've all been distributed, you know, masks to wear to make sure, and also measures have been put in place to, you know, respect that 6-foot physical distance as well.
And we do want children getting their immunizations this summer. So I'm just going to put that plug out there.
So we've got just over 3 minutes. Any members of the media who did not get a chance to ask a question yet, please go right ahead. Well, and if there are any folks that have asked questions and would like more, please go right ahead.
I have a clarification question. At the beginning, you guys said that 3 children had tested positive at UNC. Is that at all UNC healthcare hospitals, like in general?
And a great question. I'm specifically talking about the medical center here in Chapel Hill. And just the 3 that have tested positive, I was specifically referring to 3 patients that were admitted that tested positive. We certainly have had a number of children test positive from an outpatient standpoint, but I'm just talking about 3 children that were admitted, and I was specific to the med center.
Their cases were serious enough that they needed to be hospitalized.
Correct.
Right.
And I have one last question. The children who, you know, are you doing routine screening of all the kids who come in? Because you said that you had screened one of the children who was asymptomatic for surgery. You know, so as kids are coming in, how often are you doing that screening?
Yeah, that's a great question. We're screening, as you said, Rose, all children that are coming in either for surgery or procedures are being screened for COVID. And we want to make sure that they're negative, unless it's an emergent surgery, before we take them into surgery or to that procedure. If they are positive, and we've had 1 child who was positive with COVID, that child needed an emergent surgery. So of course we went ahead and did that. We are also screening, if there are any concerns in our emergency room, we do rapid testing of those children and adults as well, I believe, but I'm speaking mainly for the children, rapid testing of the children before we admit them to our inpatient unit. What we are not doing at this point, we are not screening every child who comes to clinic for COVID. We're screening them for symptoms. So we're asking them about runny nose, cough, fever, checking their temperature. Here at the hospital, we're checking everyone's temperature in children's to make sure you don't have a fever. That's what we mean, because it is confusing. There can be screening either for the actual presence of COVID or screening from a symptomatic standpoint. That is important to clarify. But any child who's coming for a procedure is getting screened for an actual test.
We are actually under 1 minute, so I apologize for that. Right. We'll have to extend, and we'll have to buy the new and improved version of Zoom.
Okay.
But thank you all for joining us. We'll upload this video as soon as we're done, and also we'll have the audio file if folks want that as well. Thank you very much, and thank you to our speakers.
Okay.
Thank you.
Thank you.